Dear friends, very good afternoon. I'm Dr. Winnie Joyce from Kristu Jayanti College. Today we are going to discuss on process of social casework. Social casework is one of the basic methods in social uh, work. Coming to social casework introduction, so there is a definition given by Lee. Social casework is the art of changing human attitudes. So any individual who has a problem, who's suffering with a problem, so the social caseworker will get intervene with a client where his problem can be sorted out. And there are three objectives involved in social casework. One is about understanding and solving the internal problems of the individual. Any individual who has a problem, when he approaches the organization, so the caseworker will take up the case and trying to solve the problem of the individual. Second one is strengthening his ego power. So make the client to understand his reality and helping the client to perform his roles and responsibilities in an effective manner. And the third one is preventing and remediate of problems in his social functioning. So there are three major steps involved in social casework. One is on psychosocial study, the second one is psychosocial diagnosis, and the third one is social treatment. So we are going to see and each and every step in detail. The first one is psychosocial study. So here the caseworker should make an investigation on in understanding the following facts. One is picture of the problem. So the caseworker should study about the major complaints and when the problem has started in the client's life and how serious the problem is, what are the major causes involved in the problem. And second one is the caseworker should understand the client's feelings and reactions. And the third one is any problem who comes into an individual's life, the individual would have made an effort to solve the problem. So the caseworker's prime responsibility is what kind of efforts have taken so far by the client in solving the problem. And the fourth important point is psychosocial development of the client. So it is a major responsibility of the caseworker to study the home environment, marital history and occupational history, which is addressing the problem in a wider perspective. And the fifth important area is the caseworker should study the personality of the client. Then this is the second process which is involved in social diagnosis. After trying to find out the social diagnosis, the caseworker should make a diagnosis of the client's problem. So the first one is content of diagnosis. So here, what sort of problem the individual is facing and what kind of personality or what kind of person the individual is who is bearing the problem. And the third important factor is whether the agency is having enough purpose in solving the client's problem. And the second important point is types of diagnosis. The caseworker should choose the type of diagnosis. There are three types of diagnosis this involved. One is dynamic diagnosis. So dynamic diagnosis is mainly focusing on the current scenario of the problem. And the second one is etiological diagnostics. Certain problems where we need to find out the root cause from the beginning of the, from the life history of the client. So that needs to be studied. And the third one is clinical diagnosis. So the caseworker should understand the clinical manifestations of the client's problem, which made the client to get into a malfunctioning towards his personality due to clinical issues. And there are three steps involved in diagnosis. One is focusing on problematic behavior. Then the second one is targeting the specified behavior. So the caseworker should target the specified behavior which needs to be changed immediately where the problem can be solved. And the third one is specifying the events to control the behavior. So how he can, he can control his behavior in forming certain modalities. And then objectives of the intervention to be established, what kind of intervention can be given to the client, and priorities needs to be fixed by the caseworker in giving treatment. And this is about the social treatments. This is a major steps which is involved in treatment after analyzing the factors and the causative issues. Then we need to provide a treatment to the client. So the treatment should be basically in addressing social breakdown. So he should not he should be prevented from social breakdown. And it is a major responsibility. Any individual who comes with a problem, they may have certain abilities, so the caseworker should understand the abilities of the client or the strength of the client, which needs to be developed or enhanced in a wider manner where the problem can be sorted out. And the third important point is restore the social functioning. So it is the caseworker responsibility to help him to restore his social functioning. And also every time whenever the problem comes into an individual where he requires some kind of self direction, which can be established only through self awareness, so that needs to be enhanced by the caseworker. And then we are trying to make a client to increase his social contribution. So these are the steps involved in treatment. One is motivation and clarity. So the client needs to be motivated in a positive way, and role clarity needs to be given by the caseworker. And the caseworker should establish the treatment goals in addressing the client's problem. And the third important point is where the caseworker should develop a treatment plan where it should be mutually agreed by the caseworker as well as the client. And then the caseworker should prepare the client to in making the client to come for actual treatment, and then treatment needs to be in place in practice at the right time. So there are three ways of providing treatment for the client. One is direct method, the second one is indirect method, and the third one is administration of practical service. So direct method is directly involving dealing with the client with the certain therapeutic interventions, where we are calling it as a counseling, therapeutic interviewing, and interpretation and insight. And the second one is indirect method, which is calling as an environmental modification, certain problems where the environment needs to be changed. So that would be the major cause for the causing the client's problem. So that needs to be modified or changed, where the caseworker can bring appropriate social conditions where the client can solve the problem. And the third important point is practical services, where certain problems where the client may require certain resources, where the resources which would be more helpful in coming out of this client. So that needs to be addressed by the caseworker. After giving a treatment, there are three steps involved where evaluation. So once the treatment is given or the intervention is provided to the client, the caseworker should make an attempt to evaluate the client's problem, the progression, and then necessary steps need to be taken and to be followed whether the client is all right in his life situation or not. And then once the caseworker feels or the client is happy about the intervention and he has progressed gradually, then termination can be introduced to the client, where the relationship can be terminated. Once the termination is done, the caseworker can do a follow-up. Thank you so much for listening. I'll meet you in